We're Team 1 and today we do our presentation on calcium channel blocker. Calcium channel blockers are a class of drugs that block the flow of the electrolyte calcium through calcium channels. They slow the rate at which calcium passes into the heart muscle and into the vessel walls. This relaxes the vessel and then this relaxed vessel let blood flow more easily through them, thereby increasing the supply of blood and oxygen to the heart. By dilating the arteries, a calcium channel blocker reduces the pressure in the arteries. They are used to decrease blood pressure, control heart rate, and reduce chest pain due to angina pectoris.
There are types of calcium channel blockers. Calcium channel blockers are class 4 drugs, the antiarrhythmics. Therapeutic drugs, the use of it are hypertension, angina, and arrhythmias. Common side effects include constipation, nausea, headache, rash, edema, low blood pressure, drowsiness, and dizziness. How do the CCB work? Calcium channel blockers are derived for their vasodilator and cardiodepressant actions. Systemic vasodilation reduces atrial pressure, which reduces ventricle afterload and decreasing oxygen demand thereby. The more cardioselective calcium channel blockers, they decrease the heart rate and contractility, which is in reduction in myocardial oxygen demand, and therefore they are excellent anti-anginal drugs. And finally, calcium channel blockers can also dilate coronary arteries and prevent or reverse coronary vasospasm, which increases oxygen supply to the myocardium.
There are mainly three types of calcium channel blockers. The first one is dihydropyridines, and it's highly selective for smooth vascular selectivity, and these drugs are primarily used to reduce systemic vascular resistance and arterial pressure, and therefore they're primarily used to treat hypertension. An example of this would be amlodipine and nifedipine. Then we have two other classes of calcium channel blockers, one of which is the phenylalkylamine, and it's a non-dihydropyridine. It's selective for myocardium, for the heart muscle, and it's less effective as a systemic vasodilator drug. It's mainly used for the treatment of angina by reducing myocardial oxygen demand and reversing coronary vasospasm. An example of this would be verapamil. And finally, we have the benzodiazepine class, and it's selective for vascular calcium channels, and it possesses both cardiac depressant and vasodilator actions by reducing arterial pressure without producing the same degree of reflex cardiac stimulation caused by dihydropyridines. An example of this would be diltiazem.
This is just a quick cartoon, and the disease states that require the use of calcium channel blockers are hypertrophic cardiomyopathy, coronary artery disease, coronary artery spasm, angina, and cardiac syndrome X. The first disease state, hypertrophic cardiomyopathy, is a disease of the myocardium, or the heart muscle. It's where the heart muscles become thickened or hypertrophied, and it occurs mostly at the septum. And the septum is basically a muscular wall that separates the left heart from the right side of the heart. And when this septum thickens, it blocks or reduces blood flow. So the arteries have to work harder to overcome this blockade. And the causes of this is a defective gene such as a MYH7, alpha-tropomyosin, troponin T, and myosin binding protein C. It can also be caused by hypertension and the natural aging process. The second disease state is coronary artery disease. It's also known as coronary heart disease. It's when plaque builds up in the coronary arteries, leading to atherosclerosis, leading to angina. And the composition of plaque includes fat, cholesterol, and calcium. And this is a diagram of a vessel diagnosed with atherosclerosis. Coronary artery spasm is a temporary narrowing of the coronary artery. It's when because of the narrowing, blood flow is greatly altered, leading to starvation of oxygenated blood to the heart muscles. And the spasms occur because of the contraction of the arterial muscles. And the spasms occur in the arteries that have plaque or arteries that have not become hardened due to plaque. And the fourth disease state is angina, also known as angina pectoris. It's severe chest pain from ischemia of the myocardium. It's basically lack of oxygen to the heart. It's caused by obstruction or spasms of the coronary arteries leading to the heart muscles. It's caused by the imbalance between oxygen supply and demand. Basically, there's an increase in oxygen demand without a proportional increase in oxygen supply. And the last disease is cardiac syndrome X. There's no exact theory as to why or what's the cause of this, but there's a postulate out there. Patients show symptoms of angina but no cardiac artery disease. It's predominant in women, and the theory for that, it's not exact, but researchers believe that the dynamic estrogen levels, because women are exposed to fluctuating levels of estrogen throughout their lives, and so a change in estrogen levels causes a change in the behavior of blood vessels.
Calcium channel blockers work by blocking voltage-gated calcium channels in cardiac muscle and blood vessels. By doing this, they decrease the intracellular calcium, and so there is a reduced muscle contraction, allowing vasodilation. Therefore, vasodilation decreases total peripheral resistance, and this can also decrease cardiac output, which helps with blood pressure in that way because it decreases blood pressure, the pressure around the walls, and it helps with angina as well. Specific drugs include amlodipine, which is used to treat both hypertension and angina, both stable and unstable angina. It's a potent peripheral vasodilator. It has the longest half-life, therefore it can be taken once daily. And it has a greater effect on vasodilation than diltiazem and verapamil. Nifedipine is also in this class, and it works both on hypertension and angina. It comes in immediate release and extended release, and the immediate release should only be used to help treat with chronic stable angina. Aside from these drugs, other classes of medications such as beta blockers, cholesterol-modifying medications are also treatments for coronary artery disease. Other drug targets include verapamil, which is a part of the phenylalkylamine class. It's used for hypertension and angina as well, but is selective for myocardium. It's a cardio-specific medication. It plays a more important role in angina versus hypertension, and it works in treating angina because it reduces myocardial oxygen demand and reversing coronary vasospasm. Diltiazem is in the third class, which is a part of the benzodiazepines. It reduces heart rate and blood pressure. It's an intermediary between verapamil and dihydropyridines. Because it is cardiac depressant and vasodilator effects, it can decrease arterial pressure without producing the same degree of reflex cardiac stimulation. Diltiazem is used for the management of both stable angina and unstable angina.
In summary, calcium channel blockers are class 4 drugs derived for vasodilator and cardiodepressant actions. They're used to treat hypertension, arrhythmias, which is irregular heart rate, and angina, which is chest pain. Targeting voltage-gated calcium channels, and they slow influx of calcium into the heart. There are few diseases that calcium channel blockers target. Examples are hypertrophic cardiomyopathy, coronary artery disease, coronary artery spasm, angina, and cardiac syndrome X. By blocking voltage-gated calcium channel blockers reduce intracellular calcium decrease muscle contraction, and they cause vasodilation, which decreases pressure along arterial walls. There are 3 drug classes under calcium channel blockers. Dihydropyridines, example is amlodipine, and non-dihydropyridines include classes of phenylalkylamines and benzodiazepines. Phenylalkylamines, example is verapamil, which is cardio-specific, and benzodiazepine is example is diltiazem, and this is cardio and vessel-specific.
And that includes our presentation.